It is Thursday, February 19th, 2026. Yesterday it was like 40 and it was drizzling when I went outside to go do watch. By the time I got to the bus stop, the drizzle had died down mercifully, but it was windy. It was kind of nasty, pretty cold. So it got colder throughout the day, and we got a nice undercoat of black ice on the pavement, followed by 3 to 4 inches of snow throughout the rest of yesterday. So apparently the roads were super bad yesterday. I got like the light version of it after shoveling out the driveway, and the streets were still pretty gnarly when I got out this morning. But once I actually got out there, had to park a little bit farther than I normally did because I don't want to park on a hill when the streets are still slick. It was really peaceful. 3 or 4 inches of snow. I mean, it was the same routine for everybody going out. People were driving a little bit more slowly. But it's the acoustic landscape was so different between 3 or 4 inches of fluffy snow, and the wind was not nearly as biting. Um, it's just kind of wonderful how the same place can be so different even 24 hours apart. All right, so after that this morning, I've been watching Minnesota Senate legislative sessions. Yesterday was Department of Employment and Economic Development. Today has been Health and Human Services. So it has been pretty cool now that the legislature is back in session. I'm really taking a look at a lot of the testimony that's being given. And for the most part, this is testimony from experts and nonpartisan groups within the state. But oh man, the big impacts or the big testimonies are basically the calculated impact and what we expect as some of the legislation from HR 1 or the big bastardized bill hits us in 2027. So just kind of rattling through some of the highlights or really lowlights, because I'll put it in summary right now. This bill is not just fund domestic terror with an unlimited money pool. Now we're really taking a look at where that money pool comes from. It comes from Medicaid. It comes from SNAP. It is, God, it's such an awful piece of legislation, and we're not even feeling it yet. We're just kind of spelling out what this is going to mean, and it's truly a war on the most vulnerable people in our population. So anyway, some of the highlights. Yesterday's Department of Employment and Economic Development hearing was pretty interesting. One of the biggest things that I took away from that was that we have a declining workforce in the state. And much of our workforce growth depends on immigration. Now, we do have a positive trend for domestic immigration because Minnesota is a great place to be and people are waking up to that. But foreign immigration, which is also which is the biggest driver, according to the experts that we had yesterday, of our working age population growth, is basically an unknown. We assume that we will see none of it until we see federal policy changes that aren't not only preventing anybody from immigrating legally, but actively demonizing our immigrant communities and preventing even those that are citizens from participating in the workforce. So into Health and Human Services, I think some of the problems are a bit more pronounced. And I'm still at the point where, I watched this maybe an hour ago because it's all live today. So I'm still trying to kind of form a coherent narrative for all of it. But frankly, I don't think there's any more coherent, summarized way to put it than just watching the testimony. And I'll link at least the live session here so that we can see, or you can see the full unedited version. But so far, some of the things that have really stood out. So first, let's talk the overall amount of funding coming in from the federal government coming into Health and Human Services here in Minnesota. So HHS, or Health and Human Services, is, in my view, an incredibly important, if not the most important, branch of our federal government because it's healthcare and food, and it's specifically those things that are helping the most vulnerable people in our population. So we are expecting to see $1.4 billion per year decreased budget for Health and Human Services as a result of HR 1. Over half of that HHS budget for the state is federally assisted, and it's largely because of those larger entitlement programs that we're all familiar with, such as Medicare and Medicaid and SNAP. However, Minnesota pays to administer most of these programs. Most states don't even do that. but we are bearing the cost of administration for a lot of these things. So Medicaid, for example, any administrative work to make sure people are enrolled or any of the bureaucratic side of things, Minnesota handles. And for what I understand, not particularly efficiently. The testimony today, there was a big focus on just how much we have not invested in technology modernization because there's not a whole lot of funding for that. We don't really get federal funds that allow us to go modernize technology um, for the administrative burden of the Medicaid program. But that is one of the big areas that was cited as being a huge problem in getting money out to people effectively. Now it's being exacerbated because the administrative cost that is going to our county level to administer a lot of these services is going to increase dramatically. Like we're talking double the amount of administrative work, and that's specifically for one provision of HR 1, which is workforce requirements. Basically, in order to get Medicaid benefits, if you are, I can't remember if it's single or no dependents, but basically like a working age, you have to show that you've worked, 80 out of the last, basically 20 hours a week. And if you don't, well, good luck. But you have to verify that. So they're asking, it's like a doctor's note, except from your employer, in order for you to get basic healthcare benefits. Especially like if you're on a disability, for example. It's pretty gross. We luckily have not had time in these hearings. There's so much to get to, and these experts are being reined in to 5 minutes, which is honestly not enough given the ridiculous impacts that our current legislative environment is putting them in. We did hear one talking about misspending from these programs, estimated at about 8%. Fraud is still top of mind for everybody, and our ability to find and punish it, is decreased at the moment, but it's definitely something that everybody's looking at. One thing that's noted in a lot of these health and human services is that $1.4 billion, well, the expectation is that is going to have to be made up by rolling over to state funding mechanisms, including property taxes, which we've seen drastically skyrocket in the recent past, and we're expecting to go up even more. And one of the big things that our testifiers brought up in the HHS meeting is that property taxes don't just affect those who own property. I mean, they do in an outsized way, which makes sense, but they also affect renters. Renters absorb property tax increases because we have a system that basically allows that to be just passed on down to the most vulnerable, just like anything else. So that's something worth noting, is that when we say property tax, and that's how we have to pay for most of this, and they're already very high and getting higher, it is not just affecting those with property. Those with property that they rent or lease to others just pass that cost down. Oh, so we had a number of testifiers also talking about food insecurity. So with the cuts to SNAP benefits, we had local food banks, including Second Harvest Heartland, a director or two from there, and other food distribution volunteer networks here in the Twin Cities. They gave some pretty interesting stats as far as the role that food banks play in our environment as opposed to SNAP or EBT, basically supplemental food assistance that people are using in order to pay for foods at the grocery store. Food banks only help about 10% of local hunger, whereas SNAP is about 90% of nutritional assistance programs in terms of funding and in terms of volume of food distributed there. So with severe SNAP cuts incoming, we also have the statistic that 1 in 5 Minnesotans rely on some form of supplemental food assistance. We've heard testimony that our food distribution networks are at capacity. Any cuts to SNAP are basically hunger that we don't have the infrastructure to fill in or help. So that is a major problem, because while people can donate to food banks, they just don't have the infrastructure or network or ability to get that to people like SNAP can, which is really just getting the money that's earmarked to spend on food. We also saw testimony from an insurance agent who testified to the direct effects that the lack of any insurance subsidies are having on people. They gave an example of a 64-year-old couple who was paying with the ACA subsidies prior to expiration about $75 a month per person for healthcare. and their premiums are jumping to $2,300 per person per month. So that's an extreme example, but it is a very real one, and one that has been pretty emblematic of the conversations that this agent has had to have with the persons that they insure over the past several months. It just sounds like it's bad news for everyone. So if you are insulated by that, know that there's some real shit going down in terms of people being able to afford food or health care as a direct result of HR 1. And I expect that the things I've talked about today are not specifically directed at Minnesota. This is going to be emblematic, or you're going to see ripples of this happening across the country, with the caveat that some of these laws, I think the distribution of funds has definitely been weaponized for some states, but not others. For example, the states that have the worst rates of SNAP fraud basically have a waiver or disclaimer that allows them to go longer without the impacts from the big beautiful bill, mostly because the states with the worst examples of SNAP fraud are red states. All this to say, seems like a pretty good time for me to take an unpaid and uninsured leave from work, huh? Woo! That's officially on the books now. So I am, basically freed up my calendar for the rest of 2026. I think not great timing from a health insurance point of view. It looks like it's going to be unfeasible for me to afford medical insurance from the marketplace, given the current landscape. So I will be taking a look at the tax penalties and the general cost of being uninsured versus having health insurance in a system that is entirely and purposefully broken by our current I won't say Republican colleagues, by the enemy. It's been fucking occupied by the enemy. There is some good news, at least for me personally. I mean, it sounds like from the testimony that we heard today, one of the major shortfalls or areas where there is work that needs to be done is in IT infrastructure. There are lots of inefficient manual processes that make the cost of administering a lot of these programs way greater than it should be. IT infrastructure is top of mind, and I think there are people who want to, improve that. And as somebody who's done IT systems with revenue cycle, healthcare, it's an area where I think I've got an applicable skill set, and will likely need to leverage that to find healthcare. But I think at the very least, I can be pretty picky, and I will be pretty picky about any new employment. I think for the longest time, and something that's very familiar, the dollar amount that I'm being compensated has been the primary principle by which I'm looking for employment. But I think I'm comfortable enough, having done that in the past, that I can really focus on finding employment where either the leadership or the mission, or preferably both, aligns with my beliefs. So at current, I really have no idea what my future will hold. Exciting times.